Okay, so first I'm going to give a bit of a background about H. pylori, the motivation for this research, and who the Can Help Working Group is, and what our research aims are. And then I'm going to go into a little bit more detail about each of the 3 current community projects. So first, this is a photo of H. pylori bacteria, such as the one outlined in yellow, and H. pylori embeds itself in the stomach, lining of the stomach, or the duodenum. So H. pylori is thought to infect half or more of the world's population, and most chronically infected individuals have asymptomatic gastritis. Some individuals will experience chronic dyspepsia. However, it should be noted that upset stomach can be caused by many different things. And a small fraction of cases will develop peptic ulcer disease, and in very rare cases, gastric cancer. So treatment for H. pylori requires a combination of 3 to 4 drugs taken for about 7 to 10 days. And under ideal circumstances, treatment is effective around 80% of the time, so treatment failure is quite common. And research has been inconclusive so far about the mode of transmission, but it is thought to be most likely transmitted from person to person, and the likelihood of transmission increases during bouts of acute gastroenteritis with vomiting and diarrhea. And public control measures for H. pylori infection have not yet been developed. The motivation for this research comes directly from the communities involved, who voiced their concern about H. pylori infection based on an awareness that the many people in their communities are infected with H. pylori, as well as the perception that there are higher rates of gastric cancer in these communities, and an awareness of the link between H. pylori infection and gastric cancer. And finally, the frequent failure of treatment in these regions. So in response to these concerns, the Can Help Working Group was established in 2007, the Canadian North Helicobacter Pylori Working Group, with 3 specific research aims: to address these community concerns about H. pylori health risks, to recommend management strategies to local health authorities, and to reduce the health risks from H. pylori infection. So the Can Help team is a collaborative effort linking northern community organizations, Northwest Territory and Yukon health agencies, and Alberta Health Services, with a variety of investigators from different disciplines at the University of Alberta. The 3 community projects that are ongoing are the Aquatic H. pylori project in Aquatic, Northwest Territories, the Old Crow H. pylori project in Old Crow, Yukon Territory, and the Inuvialuit Settlement Region, or ISR H. pylori project, taking place in the 5 communities in the region in the Northwest Territories. So each project is designed in collaboration with a community planning committee and is typically comprised of 6 main components. First, H. pylori screening through urea breath test, or UBT, followed by questionnaire-based interviews with 3 distinct instruments. The first to assess clinical data on current symptoms and medical history. The second to look at socio-environmental exposures at the individual level. And the third to look at socio-environmental exposures at the household level. Endoscopy, upper endoscopy, is offered to all participants who would like one, and treatment is offered to H. pylori positive individuals. Following the disease investigating components, there is knowledge exchange and policy development. So these projects aim to conduct a comprehensive investigation of H. pylori infection in northern communities, with a focus on addressing community concerns about the health risks associated with H. pylori. So following screening for H. pylori infection and collecting clinical and epidemiologic data, we offer upper endoscopies and obtain 4 to 6 biopsies per person, with the aims of characterizing the histopathology in relation to infection and estimating the prevalence of strains with antibiotic resistance and virulence factors. And finally, we would like to evaluate the effectiveness of anti-H. pylori therapies in these communities. So first, I'd like to talk about the Aquatic H. pylori project, which was established in 2007. And Aquatic was selected by the Northwest Territories health authorities as the starting place for this research because of the high level of concern due to gastric cancer deaths in some members of the community. So Aquatic is located in the northern part of the Northwest Territories. The population is roughly 590 and predominantly Inuvialuit or Gwich'in Dene. The Aquatic H. pylori project had 379 participants, so over half of the community population, and we had good participation throughout all of the disease investigating components. So of the 333 people who were tested for H. pylori through UBT, 313 had viable results and 58% were found to be positive. And to give a bit of a frame of reference for that prevalence, although a nationwide prevalence is not known, based on studies from various locations across the country, it is expected that the prevalence is around 20 to 30%. So here we see the percent of individuals who had the following conditions as seen through the scope. It should be noted that conditions seen predominantly in the duodenal region are characteristic of peptic ulcer risk, and conditions seen in the gastric region are characteristic of gastric cancer risk. So a high ratio of gastric to duodenal conditions is characteristic of a population at higher risk for gastric cancer, as seen here in Aquatic. Important to note in this slide is that 1/3 of people with tissue damage in their stomachs reported no digestive symptoms, indicating the impact of subclinical disease in this infection in this community. To move on to the pathology results, we see this frequency of severe inflammation is very uncommon. Note that 98% of individuals with H. pylori infection had inflammation, 90% having moderate or severe. And again, with the pathology results, we see that nearly 40% of people with tissue damage reported no digestive symptoms. So among people with H. pylori infection in a clavic, there is an increased frequency of severe inflammation and conditions that reflect an increased risk of gastric cancer. This assessment suggests that community concerns over H. pylori infection and gastric cancer risk are well placed. Here we see the presence of symptoms by H. pylori density. And it should be noted that in 22 participants with severe symptoms, 55% were found to be H. pylori negative, indicating that the burden of digestive symptoms in this community is not solely attributable to H. pylori infection. The treatment trial associated with the Aquatic H. pylori project compared the standard treatment to alternate treatment. Standard treatment is proton pump inhibitors, or PPIs, with clarithromycin and amoxicillin or metronidazole for 10 days. And the alternate treatment is PPIs and amoxicillin for days 1 to 5, and PPIs with metronidazole and clarithromycin for days 6 to 10. So of 313 people tested, 58% were found to be positive, and of 58% was offered treatment, and of those, 111 participated in the treatment trial. However, only 87 did a follow-up breath test. And standard treatment was found to be 60% effective, and the alternate treatment was found to be 74% effective. However, our sample size is too small for precise estimates, and more data is needed. There was also evidence of antibiotic-resistant strains in this community, the most common being resistant to metronidazole. Knowledge exchange activities culminated in the development of a video documentary titled after the Aquatic motto, "Never Say Die," representing the perseverance in this community. And the purpose of this documentary was to reveal the research process to the community. And so far, we've received very positive feedback from this. Now I'd like to talk about the Old Crow H. pylori project, which was established in 2010. This project was initiated because of the positive feedback from the Aquatic H. pylori project. And in 2008, the MLA, Darius Elias for Old Crow, approached the Can Help working group and asked us to bring the research to Old Crow. Old Crow is located in the northern part of the Yukon Territory with a population of roughly 250 and predominantly Untitled. And Old Crow is accessed only by air. Again, we see very good participation throughout the disease investigating components of the Old Crow H. pylori project, with 178 providing breath test results. And of the 178 who provided breath test results, 157 had viable results, and 70% were found to be positive. The endoscopy and treatment components of the project are upcoming. The endoscopy is scheduled for January 2012, in which a team of gastroenterologists and nurses from Edmonton will travel up to Old Crow and offer endoscopies to anybody who would like one. And following that, H. pylori positive individuals will be offered participation in a treatment trial to compare therapies. The last project I'd like to discuss is the ISR H. pylori project. The ISR includes the communities of Tuktoyaktuk, Saxe Harbor, Paulatuk, Ulahuktuk, and continued work in Aquatic. So we have begun work in Tuktoyaktuk with a pilot project last March. And this project was initiated because of the positive impressions and results from the Aquatic H. pylori project. And the governing body, the Inuvialuit Regional Corporation, requested expansion to other communities in the ISR. So Tuktoyaktuk is on the far north peninsula of the Northwest Territories. The population is roughly 870, with predominantly Inuvialuit, First Nation, or Métis residents. And Tuk is accessed by air, water, or ice road in the winter. There were 93 participants in the pilot project, and ISR adapted clinical and epidemiology questionnaires were piloted on these individuals, and 86 individuals provided breath test results. However, we cannot report the prevalence at this time. So next steps for the ISR H Pylori project. The planning committee will meet in January to discuss the next steps, and tentatively, data collection in Tuk is tentatively set for the early spring of 2012. And expansion beyond work in Tuktoyaktuk, expansion to other communities in the ISR will occur in order to obtain representative data. So some of the preliminary conclusions. We have observed a high prevalence of H. pylori infection in Aquatic and Old Crow, and a high frequency of H. pylori stomach disorders in Aquatic that indicate community concerns are warranted. The Can Help Working Group aims to identify strategies for reducing the H. pylori-associated disease burden. A few acknowledgements, and thank you.